For the past 25 years, Health Systems Trust has operated as a leading force in the South African public health arena. Established in April 1992, HST has played a significant role in the evolution of the new national health system. Today, our strength lies in the knowledge, insight and experience that we harness through synergizing our research and implementation work in pursuit of our vision of health for all through strengthened health systems. 2017 marks the 20th edition of Health Systems Trust's flagship publication, the South African Health Review. The publication was born out of a need to document the transformation of South Africa's health system and provide evidence on health policy and initiatives from as many sources as possible. The South African Health Reviews constitute a comprehensive repository offering critical information for monitoring and evaluation. The first edition of the review appeared in October 1995, and at the time, the Star newspaper described it as the first of what is expected to become the standard annual reference work on the health sector.
Come 1994, some forward-thinking South African public health people, together with the Kaiser Family Foundation, said, wouldn't it be fantastic if we now thought forward, if we started to say, this is what our health and healthcare looks like right at the birth of democracy. And let's put in place a process of gauging trends, gauging progress over time, so that we can look back 20 years later and say, how have we done?
2 decades later, the SAHR is now accredited by the Department of Higher Education and Training as a peer-reviewed journal. SAHR Managing Editor Ashni Padarath has been involved in the production of the review for the past decade. During that time, she's witnessed the evolution of the review.
Over the years, the focus of the review has shifted from identifying areas for policy development to providing an analysis of the implementation of those policies at various levels of the health system. The review not only provides a platform to share promising models, good practices and lessons learned, but also to change thinking around health systems reform in South Africa. None of this would be possible without the support of the broader public health community, who in the spirit of collegiality have generously contributed to the review and helped to generate evidence and stimulate debate on health systems reform in South Africa.
The World Health Organization's 6 building blocks for an effective, efficient and equitable health system provides a framework for the themes presented in the SAHR. The interconnectedness of these building blocks is critical for health systems to work as a whole.
We were asked to write an overview of the South African Health Review for the last 20 years. We tried to see what was written in 1995 and then contrast that with developments over the years. And in concrete terms, there's now almost 4 million people who take antiretroviral drugs on a daily basis. And the number of children who've been infected from their mothers has declined from about 75,000 to around about 5,000 in 2017. So that's been a phenomenal success story.
Contributors comprise the who's who of health systems and public health and is widely used by academics, researchers and students, policy and decision makers, NGO program coordinators, clinical staff and healthcare workers and funders. The Director General of the National Department of Health describes the SAHR's value as a useful reference tool and how this has contributed to the department's work.
Well, South African Health Review is my favorite publication. In fact, I used to refer to it when I was in WHO more than when I was in South Africa. For me, it must be on a desk of every health planner, every health manager, and every policymaker.
I prescribe it for my module, Introduction to Health Policy and Management, and we use it actually very widely when we go on, whether it's our talks globally or regionally. And actually it's one of the best resources that we use. This is the one book that you do not go into the exam without reading it.
Leading health news agency Health E has found the review indispensable in reporting on new and emerging health issues and translating issues for a wider audience.
They do good work, they really do. The unsexy hard work that most people don't want to do. So you can see easily which are the worst performing provinces. And you can see by year We actually ended up making a documentary about kids in the Eastern Cape. I can't say whether it made a difference or not, but it certainly did draw attention to the fact that kids couldn't get vaccinated against measles.
This year we are celebrating our 25th anniversary. So the future, I think, is very important for us going forward. If you look at it, one, the entire development space is looking at the Sustainable Development Goals, and of course the third one of those is ensuring a healthy life for all people. So one of the important things that we will be doing will be making sure that we make an important contribution to attainment of the country's own Sustainable Development Goal target. The second is national health insurance. So it's going to involve major changes in the way the health system functions, make sure that there is much more equitable access to health services in the countries. And for an organization like ours, this is an area where we feel the expertise that HST has can make very important contributions.
Sometimes critical, sometimes laudatory, over the past 20 years, the South African Health Review has consistently provided the critical nexus between researchers and users of research, as it has documented the country's efforts to build a fair and equitable health system. Firmly entrenched as a reliable barometer of the transformation of the South African health system, there's no doubt that the SAHR will continue to capture our journey towards the implementation of universal health coverage and attaining access to health for all.